So this is something we present at ISHL 12, and this is some work from our research group that is trying to really, what I said is the answer to the first question. The idea is really, first of all, we can obviously use these tools to guide patient treatment better during treatment, but also we would like to have maybe a better idea about risk at the beginning, just looking at, when a patient is newly diagnosed in this setting. And what we kind of have to ask ourselves on the peculiar situation in Hodgkin lymphoma, I think that is different than in other lymphomas, is that we have the situation where maybe and this is quite unique, where maybe the tumor biopsy is not the best tool to get genetic information about the tumor, because the Hodgkin-Sternberg cell is so rare in the tumor biopsy. And maybe here, and maybe this is the only cancer where that's the case, the liquid biopsy is actually the best tool to access the tumor genome. And then maybe this will be something we'll use in the future to stratify patients by genetic lesions. And what we're trying to do is we're trying to do this in large cohorts of patients, which we fortunately have available, and then try to look whether certain genetic alterations kind of come together, or whether certain kind of are in two groups, let's say mutually exclusive, and use that information to cluster patients based on genetic similarity and see whether these groups are then associated with phenotypes, for example, with viral associations or with the pathological histological subgroups, and all these other parameters we have with microenvironment associations, obviously. And I think this is something where we really need to integrate all these kind of levels of analysis and all these methods to really get a more comprehensive understanding about disease biology and also biological subgroups.